A spokesperson for the nonprofit says that we treat public health like an offensive lineman in football. We only notice them when the quarterback gets sacked. Well, this year, because of the pandemic, public health has become more noticeable than ever. Authors of the report say the missteps in responding to the pandemic are rooted in a public health system weakened by years of underfunding, the federal government's failure to communicate and follow the best available science, as well as health inequities putting minority communities at particular risk.
We do hope that policymakers finally do heed what this pandemic is teaching us, which is that decades of underfunding of public health has made the nation much more vulnerable to these types of public health emergencies.
The impact of chronic underfunding on America's public health system report finds a trend of budget cuts beginning at the CDC, where funding's down 2% over the past decade. Emergency preparedness down 25% over the last 2 decades, and hospital emergency programs cut nearly 50% over the past 2 decades. The report concludes, quote, "The clear consequences of failing to address these needs can be measured in lost lives, severe disease, exhausted and traumatized public health and healthcare systems, a deeply wounded economy with widespread unemployment and underemployment, and serious learning loss among millions of children." The report doesn't limit itself to the pandemic, noting that public health affects daily lives through everything from clean water to obesity. Noting that while the U.S. spent nearly $4 billion on health care in 2019, less than 3% of that money went to public health. The report finds it's not only the CDC that's underfunded, it's local health departments as well. North Carolina, for example, increased its budget for public health last year by 2%, but cut the same budget by 1.5% the year before. The report finds that local health departments are understaffed and overburdened, and when the pandemic hit, they were left fighting a 21st century virus with 20th century tools.
Like phones and fax machines and old computers. And so they just couldn't stay on top of this pandemic in a way that is really effective.
North Carolina receives more than $200 million a year from the CDC. That's roughly $20 a person. The state has received $1 billion in COVID relief, which sounds like a lot, but the state ranks 46th in per capita COVID funding to states. The report concludes that Uncle Sam could have saved money had it invested more in public health before the pandemic hit.
I think the message is starting to be heard that public health is not something we can just invest in during an emergency.
Trust for American Health has sounded the alarm about underfunding for years. The group's spokesperson says they hope the pandemic makes it clear just how vulnerable the country really is. In Greensboro, Bill O'Neill, WXII 12 News.